And recording is on. Ethan, I'm going to hand it over to you.
Thank you, Steve. On behalf of the Department of Consumer and Business Services Division of Financial Regulation, my name is Ethan Baldwin, and I welcome you to this public hearing to discuss the division's preliminary rate decision for HealthNet Health Plan of Oregon, Inc.'s small group third quarter rate filing. The division holds hearings on all individual and small group rate filings. Each hearing is generally limited to discussion of the division's preliminary decision and final objections regarding the filing. During this time, carriers will be permitted to defend their assumptions using information submitted in the filing or indicate agreement with the findings. Carriers may not introduce new information or propose new or revised assumptions at this time. When reviewing a rate request, division actuaries consider such factors as recent and projected medical care and prescription drug costs, including any benefit changes, past and future loss ratios. That is how much of every premium dollar goes to pay healthcare claims costs. This is to ensure the requested rate is not projected to trigger federal rebates or payments from other federal programs. Division actuaries also review the recent history of rate changes and the overall financial strength, including profitability, investment income, and surplus of the company, as well as administrative costs. Division staff must also ensure that the filings meet all requirements of the Affordable Care Act and determine whether or not the anticipated number of enrollees will adversely affect an insurer's financial position. You can review the full rate request at our website, www.oregonhealthrates.org. All communication for every health insurance rate change filing, including written answers to all questions asked during the review period, are posted there as well. Our agenda for this morning will be representatives from HealthNet describing their request. Then division staff will lead a discussion about the division's review and preliminary decision on the filing. Finally, we will accept public testimony. If you'd like to make a comment on a company's filing, please unmute, introduce yourself, and make your comment. Comments will be accepted online through 11:59 p.m. today, February 14th. The division will make a final decision about this rate filing shortly after that public comment period ends today. HealthNet, please begin by introducing yourself and explain your rate request.
Good morning. I'm Doug Hale, the Director of Actuarial Services and representation of HealthNet Health Plan of Oregon. I am also joined by Brian Curley, our Vice President of Small Group Pricing, and by Dylan McKenzie, our Associate Actuary. I am here to discuss our preliminary rate filing scheduled to first impact the third quarter of 2022. Our requested rate impact reflects a rate reduction of about 3.5% from the rates previously scheduled to be in place for the third quarter. This rate adjustment applies uniformly across all plans and regions relative to the previously approved rates. Year over year, this is an average annual decrease of 2.2%, which consists of a minimum rate increase of 5%. And a maximum rate increase of 11.1%, depending on the plan and region. HealthNet has about 3,450 total members as of September 2021, of which about 1,448 of which will be impacted by this rate filing. This rate filing is reflective of the use of a more recent base period and revised projection factors for medical, pharmacy, and COVID-19 costs. No further changes were made to our product offering, benefits, or networks that were not already reflected in our first quarter filing. The overall pricing trend reflects a reduction in the annual rate from 6.5% to 5.1%. The reduction in annual trend is most impacted by our revised pharmacy unit costs net of rebates. Prescription drugs composed 17% of our allowed claims during the base period, and we used a 3.7% annualized prescription drug cost trend, and we expect prescription drugs to comprise 18.3% of our projected claims. At the time of this filing, no significant formulary changes are anticipated, and there are also no anticipated network changes. Consumers may provide feedback on our network through our customer service phone number found on our website. And this concludes our summary of our third quarter rate submission.
Thank you. division staff will now lead a discussion about the division's review of the filing and the preliminary decisions.
Thank you, Ethan. My name is Michael Sink, Senior Life and Health Actuary for the division and primary reviewer of this filing.
I'll go next. My name is Tasha Sizemore. I'm the Life and Health Program Manager for the division.
Hi, this is Tim Hinkle, Life and Health Actuary for the division.
Okay, I'll get.
Okay.
I'm sorry.
Yeah,
go ahead.
TK Keene, Administrator with the division. I see Kirsten's on as well.
Kirsten Anderson, Deputy Administrator with the division.
Okay, I'll get started. Thank you. This is the HealthNet small group third quarter rate filing. That means that this will impact any plans that renew in third and fourth quarter. As the primary reviewer of this filing, I looked at the rates proposed for the third and fourth quarter filing. The most important thing we're looking at here is that this is for rates that have already, an adjustment to rates that have already been approved. So if we did not approve these rates, there would already be a third and fourth quarter rate out there that were approved in first quarter. We call these quarterly quick kickers. They are increased by a trend amount from the first quarter rates that are previously approved. And this is a rate decrease on top of those. So when we're talking about the review of this filing, we're talking about the differences from the first quarter filing. So the range, the decrease to the increase, the range, that was all determined back in the first quarter filing. If you have any questions on some of the other factors that changed in the filing, you will need to go back and review that filing as well. There are three primary components when we review rates, three broad categories. One is the data that goes into the filing. The company starts with calendar year 2020 rates, and that was used to determine the January rates for 2022. They have updated that information, and notably there is a change based on a single member with a large claim. It changed their treatment, and this is all detailed in the filing. This had a significant impact on the pool, the entire rate for 3,000 members. So this was a very expensive treatment. The treatment has changed, and that has changed their projection going forward. We took a look at that. This highlights the very sensitive nature of large claims and the rate filings. This is something we have not usually had to focus on, so we spent a considerable amount of time looking at that. The second thing we look at is the assumptions that go into the filing. The only assumption that changed going from first quarter filing to the third quarter filing is that change in trend. Now there is a reduction, a significant reduction in the claims or in the trend for pharmacy claims. And that pharmacy claims trend came down, and we confirmed that that was not because of this single member, but due to negotiations with the company. And so I'll talk a little bit about that as well. And then we also, the final third broad category is we check the calculations that go into the filing and make sure they're correct. We approved the calculations in first quarter. The calculations have not changed between the first and third quarter. So how is this different from the January filing? First, they restated their claims, and the claims came down a little bit. And that's part of the reduction request is due to that restatement in claims. Specifically, this single member was on a very expensive pharmacy treatment program. They moved to a cheaper treatment, and that was not expected going forward. Previously, that had been anticipated to continue into the 22 calendar year onto the third quarter filings, but that has been removed. The company uses a large claim pooling method. So they do take out the full large claim and then they put a small amount back in. So it's not the full amount of these large claims that's being adjusted, but the portion that is in excess of their pooling method. Pooling method meaning that this expense is then shared with the other products that the company offers. So the last thing was that changed was that pharmacy trend, and that pharmacy trend brought the claims down, projected forward 1 year of claims trend coming down a couple tenths of a percent is then applied for a couple years on top of this lower starting point, and that compounded impact is the 2.4% overall decrease. We had no concerns with the filing. We did make sure, because this filing took the unusual step to identify the drugs used by this particular member, we did confirm with the company that this was not a change in the formulary, that this would not change for anybody else who might need these drugs and join the plan. So this is not a coverage change. This is strictly a cost projection change because of the status of an individual. And that's okay with us. We're okay with this decrease. So we are proposing to approve this rate decrease as filed. Thank you.
Thank you, Michael. HealthNet, do you have any additional information or comments you'd like to make at this time?
No additional comments, and we thank you for your time and consideration for this rate filing.
Thank you. We'll now take any public testimony. Please unmute and introduce yourselves. All right. Doesn't sound like anyone signed up to testify, so let me remind anyone listening that today, February 14th, is the last day for public comments. Those comments can be submitted through our website, www.oregonhealthrates.org. Thank you, and that concludes today's hearing.